Our guest today is Guida Brown, Executive Director of Hope Council on Alcohol and Other Drug Abuse. Hope Council is one of our clients. They contract with the state of Wisconsin for mandating assessments for Kenosha County residents, particularly when a person is charged with operating a vehicle while intoxicated, also known as an OWI. Guida is here to discuss how Hope Council uses our testing and why they find it so valuable.
Hello, I'm Guida Brown. I'm the Executive Director of the Hope Council on Alcohol and Other Drug Abuse in Kenosha, Wisconsin. And I'm thrilled to be here to talk to you about how testing from U.S. drug testing laboratories has made such a huge difference with our intoxicated driver program population. The purpose of the conversation is monitoring through biomarkers. And I want to let you know that we learned that there was a better way to monitor our intoxicated driver program clients through Pamela Bean. Pamela had been working in California, and she came to Wisconsin and realized that we were sort of behind the times compared to other countries, particularly in monitoring our intoxicated drivers. She determined that the state allowed for us to use these tests, and there was one other test available. It was called EDAC, and it was actually a blood draw that really only looked at indirect biomarkers for alcohol use. But once we found out that U.S. drug testing laboratories had tests that would look at both alcohol and other drugs of abuse and how easy they were to implement, we jumped on board. In the past, we've been the agency that people have to come to in Kenosha, who reside in Kenosha if they get OWIs, since the very beginning of that program in Wisconsin. So late 70s, early 80s by anyone's best guess. And we've been ordering abstinence since then, but realized that just ordering abstinence doesn't really mean anything. So the use of the biomarkers made a huge difference with our population. In 2010, which was before we started the direct biomarkers, 2010, we assessed 716 impaired drivers who lived in Kenosha. And as you would suspect, most of them had 1 and 2 offenses, 56 and 25% respectively. 19% of those, though, had 3 or more offenses. And the numbers on that were that 76 had 3 offenses, 33 had 4 offenses, 17 had 5 offenses, 5 had 6 offenses, 4 had 7 offenses, and 1 had 8 offenses. Fast forward to 2018, and we assessed 461 impaired drivers. Again, same sort of percentages for 1s and 2s, 58 and 25% respectively. And then 17% had 3 or more. Of those, 37 had 3, 25 had 4, 8 had 5, 6 had 6, 1 had 7, and again, 1 had 8. But I also want you to notice the impact of the numbers and how those numbers have gone down. They've gone down 36% in this instance from 2010. And that's a reflection, I believe, of law enforcement on the road. I know we're supposed to be all breaking our arms saying what a great job we've done in reducing substance impaired driving. But the fact of the matter is we have fewer law enforcement on the road. So instead of catching people when they swerve, they're now catching people when they crash. What that means for us is that we're seeing a lot higher level of impairment. There are 2 dirty little secrets in the OWI world. The first one is that while the illegal limit is 0.08, which means that if somebody blows a 0.08 BAC, blood alcohol content or higher, they can be charged with an OWI. But the average in Wisconsin is that BAC is really at a 0.15. So we're actually now at 0.16, so double the legal limit. We're not seeing people who have 0.08s or 0.10s. The other part of that is that when we do see them, it's because they have other drugs on board. So traditionally, 50% of the population now has more than just alcohol on board when they get an OWI. but law enforcement doesn't need to proceed with other testing because they catch them with the OWI for alcohol only, which really makes a difference in our testing. So we do testing on folks who come to us for any reason, of course, or whatever reason they're charged with the OWI. So it could be prescription drugs, it could be prescription drugs used as prescribed, it could be illegal drugs, it could just be alcohol. But when we make that assessment, we determine what tests they need to, what drugs they need to be tested for. And so we get a lot of pushback about, well, my OWI was only for alcohol, so why are you testing me for marijuana? And my explanation is, if you kill my loved one, I don't care what substance you're under the influence of. I'm just mad that my loved one is dead. So we're really looking at the big picture, that addiction is a disease and that we're not siloing the drugs of addiction. So it's not that we only want to look at alcohol. There are people who use other drugs and maybe don't even use alcohol predominantly. The other thing in Wisconsin is that we now have a law that anyone who has either 2 OWIs or a first OWI with a VAC of 0.15 or greater, they're required to have an ignition interlock device in their car. So if I get 2 OWIs because I'm under the influence of marijuana, I still have to have an ignition interlock device in my car. That's a waste of money, it's a waste of effort, and it's really a ridiculous idea that we're keeping people safe by putting ignition interlocks in everyone's car because they got OWIs when they might not even be using alcohol to get that first OWI or that second OWI. So in 2011, that's when we started testing. We were only including those folks who had 3 or more offenses. In January of 2014, we added those who had 1 and 2 offenses who were referred to treatment. So now in Kenosha, we use testing on anyone who goes to treatment. And for those who have 3 or more offenses, we do 3 tests throughout the duration of the driver's safety plan, which lasts about a year. So we do a test at the baseline, at the assessment, and then we do one again 5 months later and another one 10 months later. Again, we use our discretion to determine what they're going to be tested for. So some of them might only be being tested for alcohol. We have no clients who are not being tested for alcohol, so we'll always throw in an alcohol test with the other drugs of abuse, but we might not do other drugs of abuse. So I think of the old grizzled person who's had 4 or 5 OWIs and they're specifically for alcohol. We're not going to waste the money to do other testing. The other thing with that is that we do have some clients who might use other drugs, but they really only use them after they've been drinking. So again, it's an effort to not silo our drugs and not say that, oh, if you use this drug, it's okay, but if you use this drug, it's not. It's, if you use alcohol, you're fine, but if you use heroin, you need to be tested. Or if you use marijuana, that's hardly a problem, but if you use cocaine, then we're really going to test you. So we really try to look at the full picture and treat substance use disorder as the disease that it is. I want to tell a story of a client, probably the saddest client I ever dealt with. Is he had, I think, 7 offenses, and he came in and I did his assessment and I said, so do you recognize that you have the disease of addiction? And he said, I know I shouldn't be drinking, but I don't know that it's a disease. I said, okay, well, I looked you up on CCAP and you have a lot of charges. And CCAP is the Wisconsin Circuit Court Access. So any charge, any arrest that's been made on a person in Wisconsin shows up as public record. So I looked you up on CCAP and you have a lot of charges. And he said, yeah, I've got 33. And I said, well, I didn't count them, but you have a lot. And he said, I counted them, I've got 33. And I said, well, can you tell me that any of those happened because of your substance use? And he said, ma'am, I'd be lying if any of them didn't happen. If I told you that any of them didn't happen because of my substance use. All right, well, think about before you ever picked up. If you knew all the problems that drinking was going to cause for you, would you have picked up that first drink? And he said, no. Said, then are you sick or are you stupid? Well, when you put it that way, I guess I'm sick. And to me, that was seriously the saddest person I've dealt with, because here he's walking around with a lethal progressive disease, chronic lethal progressive disease, and he doesn't even know he has it. Compare that to another client I had who had 2 offenses. And at the end of my assessments, I always say, is there anything you want to tell me that I didn't ask? And he said, I'm done. If I had cancer, I'd be looking for the best doctors. And that's exactly what I'm going to do here. I'm going to look for the best treatment I can, and I'm done. And I wanted to hug him. I wanted to kiss him. I wanted to take his picture and put him up as a poster child for the Hope Council, because we don't get people who talk about it like that. We get people who talk about, their driving drunk is the same as everybody they know. Wisconsin is known for, we're known for a lot of bad behaviors around alcohol, but we're known for binge drinking. We're known for drunk driving. We're known for underage drinking. And it's really a problem because so many of our clients don't recognize the problem that they have, because it's like everybody else they know. They really think that everybody gets one OWI. And when I say, well, I don't have any OWIs. Well, no, you don't have any OWIs. So it's this expectation that in Wisconsin, everyone's going to get one unless you somehow work in the field or are in other ways different. So in our first year, we had 251 drivers who we tested. 150 of those said that 150 of those tested positive for alcohol use, which means that even after they were arrested for 3 or more OWIs, they were still drinking heavily after that arrest. The more important number, though, is that 72 of them, so 48%, told us that they hadn't been drinking at all. So that level of denial is what's so important about these tests. We can really break down that level of denial and really point out to them that they think they're not drinking, or they think they're not drinking in excessive numbers, but they really are. And so our tests are not used as a gotcha. They're really used to help people understand that their drinking is out of control. And I could give you story after story after story. Early on in our testing, we were doing 5 tests, and we were putting the PEth test in between the ETGs. So we would have 3 ETGs and the PEth test in between there. And the people who would test positive, even though they would tell us they weren't drinking. We just had one recently who came in and said, we have them fill out a piece of paper. And she came in and said, well, I just drank. And so we said, well, we're not going to do the test then. And she said, oh, no, I meant I drank NA beer. And I later had a conversation with her, and I said, nobody says that. Nobody would say I just drank and then mean that they were drinking water or anything that didn't have alcohol in it. So we had made an agreement that because we ended her plan, she complained and said, no, I didn't drink. You guys, that you misunderstood me. They said, okay, fine. We'll do 1 PEth test. And if that PEth test is negative, we'll let you off your plan in compliance. She came in, she tested, she had 134 PEth test. And I'm sure she was drinking all along. She really thought she was going to get by. And that was a person who had 3 offenses. So we are really making a difference to help them understand the level of their drinking. I'm not going to pretend that I just read today's paper. We had a person with 4 offenses, another one with 6 offenses who got charged, got arrested. So I'm not going to pretend that we're changing the world necessarily, but we are certainly changing the world for some of our clients. One of our big issues is that we have to pay for our testing specialists. Our clients pay 100% of the freight for their own tests, but those tests are a little expensive. And so we will have people who move out of our county because they don't want to pay for testing. Obviously there's some more to that, but I always say, I don't care how cheap the alcohol you're using is, if you stop drinking over the course of a year, you have more than enough money to pay for our tests. So it's really not about the cost, but we have a lot of pushback on that cost. And we also have to pay for our testing specialists. So we have considered increasing our assessment fees, but we have to be consistent with the other counties around us. And so we've done that. We have met with our legislators just to help them understand how important testing is and how vital it is to making a difference in the lives of our clients. We, in the past, had an enhancement grant that allowed us to pay for some of our tests as well as our testing specialists. And we have written other grants to help pay for that person. For those folks who have 1 and 2 offenses, we do charge an upcharge on them on the tests. For those who have 3 and more offenses, we only charge what the lab charges us to pay for those tests. But for those who have 1 and 2, we do charge a little bit more so that we can pay for our testing specialists and continue this program. The other thing, I just find these tests so important. I'm saddened that everybody doesn't recognize the value of them. And I would love for our other counties, especially our counties around us, to start doing these tests, because we do have, like I said, we have people who will move to Racine County or find a mailing address in Racine County to avoid our tests. And obviously that would not happen if they also did testing in Racine. They see the value of them, but it's a huge change in what they've done in the past. And so it makes it a little hard to push that through. But I have made it very clear to all of our partners, everyone, all of our collaborators, all of my colleagues, that if ever testing were taken off the table, if ever we were no longer able to use this kind of testing, I would leave my job in a heartbeat, because it does no good to tell somebody to abstain and then not verify that that person is abstaining. Our treatment providers are able to use urine tests. Obviously, there are some problems with those, but the bigger issue is that it changes the rapport with the treatment provider. So a client will treatment shop, and with us, they can't. We're the assessment agency. They have to do what we've ordered them to do. And we can be the bad cop to the treatment provider's good cop and still help those clients make those life-changing decisions. That's it. I'm happy to answer any questions.
I'm going to take a minute to ask some of the questions that we got via email, and then let everybody hopefully have a chance to put some questions in the chat for us. So the first question is, if applicable to Hope Council, how does USDTL's turnaround time affect your processes or clients?
We have, hi, I'm Guida, in the flesh.
What do you say, Guida?
Yeah. We have, we've had a few people who, because of the lag time, have not followed our rules and gotten themselves caught up because maybe a test gets lost in the mail or something, or because the test comes back with a positive that they say they shouldn't have, and then they're already off and running with more substance use. However, that's pretty rare. We usually don't have any issues. Usually when that happens, it's really about tests getting lost in the mail. So occasionally, we also do community testing. So we are just open to the community for like probation and parole or child custody cases. And so occasionally people are ordered to do that, and court is around the corner, or somebody wants the answers right away. And it's just, they just don't understand the time frame. We just say, you know, it's 7 to 14 days, just whatever. So it's not really a problem, except in extenuating circumstances.
Sure. And that for us on our side of it would be the difference between you're doing testing, you know, every so many months versus, you know, on the newborn testing side, turnaround time has a little bit different window of detection. So that's
Right.
great for the laboratory staff to understand.
Right.
The next question is, how did you find out about USDTL and what made you start using us? I know it's been a while. I think you said, was it 2012?
2010. So I started in 2009 here, and I was at a conference must have been in 2010 at the state conference, and Pamela Bean was presenting on testing, but it was only EDAC at that time. I don't remember what EDAC stands for. I'm sorry. And it was a blood draw. So you had to have an open order and send people to get their blood drawn. And then that got sent to a lab in Madison. And it was just a long process and not what we wanted. It was only alcohol, and it was only indirect biomarkers. So it was more about liver function than it was about actually finding substances in their blood. And it was nice that you could have other conversations about how their drinking is affecting their health, but that's not really what our role is. So I'd first heard about that, and then sort of in the same conversation, it was, oh, and U.S. Drug Testing Laboratories does these other drugs. So we got on right in the very beginning. You guys were still working on, I think, your PEth test to make sure that the PEth is qualified as the nails were. And so we got on early on in a deal, and we were the tests were a lot cheaper because we were only paying a portion of them because you guys had a grant. And so we started that, and we did that until that grant ran out for you guys. And then in 2014, we just added those 1s and 2s because we realized, well, again, we're doing the same thing. We're telling people to abstain and then not figuring out if they're actually abstaining. And so that's how we added on that 1 for those folks who have 1 and 2 offenses.
Gotcha. Great. Thank you. The next question is, what is something that we could do as a company to better serve the needs of Hope Council? And then I'll add to that, or, assessment centers in general, if there's anything.
We love those nail clippers that catch the nails.
Oh, yeah.
Really, there's nothing. I mean, you guys have been awesome to us, and occasionally I get a lab in California will contact us or something, and I'm like, no. Part of it is how we in Kenosha do business. No, we've always done business with them. We're not changing. But you guys have been wonderful to us. You've helped us every step of the way. Joe Jones is just phenomenal. Like, I email him at least once a week practically, and I don't care what time it is, he responds within like 30 minutes. It's just wonderful. I always feel like I'm the problem child for you guys because we're always screwing up on our forms, and I'm always like, sorry. And you guys are just wonderful. Really, there's absolutely nothing that I can think of that would make the relationship any better.
Great. Well, I know the feelings are mutual. We love, you're such a great advocate for us, and that you would take your time to be able to present to the staff is, it's really heartwarming for us. We're grateful to have you. I have another question. Hold on. Does every person that receives an OWI in Kenosha County get assigned to your assessment center, or are there other factors that are taken into account? If so, could you expand a little bit on that?
So in theory, yes, 100% of the people who reside in Kenosha County and get an OWI have to come here. In practice, the only ones we will not serve are, this sounds terrible, those who messed up somehow in Illinois. So if they had an Illinois driver's license and live in Wisconsin and just didn't transfer, we won't see them. And if they got their OWI in Illinois, we won't see them. And that's only because Illinois doesn't work well with their neighbors. And so they won't accept our assessment. We have different tools that we use and just a different process. And because we're so close, we just send them down to Nakasa and Lake County. And we have a lot of arguments with folks who think that we're still going to see them. And we'll say, I'll take your money. It's just not going to help you because we're not going to do Illinois' paperwork. We're not going to be able to do it. They're not going to accept our paperwork. So we really encourage them. Wisconsin does accept Illinois for those folks, but Illinois will not accept Wisconsin's. So.
Gotcha. Great. So let me see. It doesn't look. I'm not seeing any other questions in the chat so far. So I'm going to give everybody a few more minutes. I know people have questions. To use your chat, all you have to do is go to the little chat feature that's in the bar that shows up where your microphone is muted. You can type in any kind of questions that you have for Guida, if possible. I know some people might be just listening and not able to respond specifically. So do you have anything else that you want to share, Guida? Anything that's...
So, just a funny story. When we first started this, we first started doing this, she was literally our second client, and I assessed her, and I don't do a ton of assessments, but I assessed her. And she, oh, I haven't had a drink in ages. And so this had to be like July, because we started in July. And oh, I haven't had a drink in ages. And oh, okay. So her test comes back positive, and I call her on the phone and I say, hey, we're a little surprised your test came back positive. So you're going to have to come in and have a PEth test. And so she comes in, and the way our office is set up, the way the building is set up, my office is about halfway between the front door and the bathroom where we test. And so it's funny because I'm always like, ooh, positive test alert. Like everyone has all these stories as to why their test is, I wasn't drinking, but I drank NyQuil, or I did this, or I did that. So I can always tell when somebody's going to have a positive test. So she comes walking back and she says, well, we got to talk. I said, okay, well, we're going into the bathroom. We'll, it's a private place to talk. And she says, when they told me that I had to go to the Hope Council, I thought, Hope Council, what a joke. Last time you guys sent me to education. And I said, well, we're really trying. We're trying to improve our plan and our program here. And she said, and then I come back here and it's CSI. And I just loved it. I have not seen the woman again. She had one test that was positive during the course of her driver safety plan, one additional test that was positive. And I remember saying to her, remember our goal is abstinence. And she said, your goal is abstinence. My goal is to keep my driving privileges. I was like, fair enough. And yeah, so she never, I've not seen her come back. And that was really impactful because we were a joke. I mean, telling somebody that they can't drink and then not figuring out, or telling them that they can't use, and not doing any testing to determine whether or not they're using, is a joke. It's ludicrous. And so the tests have been so valuable to us. I just wish everybody would use them, because I think they are so important and so much better than a simple urine cup that doesn't say anything. We do urine cups at assessment, but I always say they're just to test the veracity of their statements. So we do the urine cup, and if it's positive, I'll just say, like, well, didn't you just tell me you weren't using amphetamines? Why is your test positive for amphetamines? That's really all that does. We don't send it into a lab for verification or anything. We just want to see, were you honest during the conversation? And some people will tell me, oh, I smoke marijuana, and then it doesn't show up, and I just think that's funny.
So that little bit of prodding helped us on some questions.
Okay.
The question is, are there any drugs of abuse that you would like to test for but currently can't?
A lot of specific benzos. And for us, it ends up being more, I mean, there are some clients, as I explained, sometimes we won't even do the drug panel, aside from alcohol, because they have 14 prescriptions of whatever. And I'm like, well, that's not, it's not going to be helpful at all. So those are unfortunately the questions that Joe has to field quite often, that, is it this, or is it this, but no, it's really, the list is really comprehensive for us for what we're doing. I mean, I don't think, has anyone ever gotten a PCP positive?
You'll have to ask Joe that next time.
Yeah. But no, other than that, no, they're really good. And that's, I love seeing it. Like when I see, oh, it's not an opioid. It's not a prescription drug. It's not Percocet. You were using heroin. That's really helpful. And too, with like the methamphetamine versus the amphetamine versus a urine cup or whatever else people are testing. I mean, I always just think people, well, I want a urine test. And I'm like, well, it's not worth the $5 you're going to pay for that cup, but all right, I'll do. So, yeah.
Thank you. So the next question is, this is a good one. How has COVID-19 affected the assessments and OW9 numbers, et cetera? Just your testing.
Oh gosh. So for testing, we closed. We thought, oh, how long can this last? Right, it'll be 2 weeks, and so we had rescheduled everybody for 2 weeks out, and then we weren't in the office. And then after that 2 weeks, we came back and started doing assessments. And my thing is, the state did allow us to do phone assessments. But I seriously envisioned somebody like drinking a beer, smoking a joint, saying, no, I'm good. Everything's fine. I haven't used in 100 years. And so I'm like, I don't think that's a very good idea. So we've continued to do in-person assessments, and we just do lots of COVID protocols with masks and temperature readings and all of that. The testing, we went back to testing in person about a month out. And again, the value of our tests are that we didn't lose anybody because of COVID, although we didn't lose anybody in the cracks because of COVID. So it didn't matter if we were a month later than we had planned because of how the tests work, which was wonderful because we have a lot of people who are playing a lot of games that, oh, COVID, oh, you guys closed. Oh, I couldn't test. Oh, blah, I'm like, no, none of that happened. The numbers went down substantially. And I'm actually just trying to find a part-time assessor right now because now our numbers went back up. And I think it had to do with, even in the beginning of COVID, law enforcement just wasn't even stopping anybody because everyone was afraid of getting COVID. And now a lot of people are getting stopped, and there are a lot of people who are getting stopped for driving after revocation. So then when that happens, we used to have a loophole in the law in Wisconsin that it was just cheaper to pay the ticket than it was to get your assessment. So people just paid the ticket. And they figured it out, and now there's a much steeper fine and jail time that could be served if they don't get in. So then they always come, like I literally just had a guy who came in today. This has been going on since July of 2019, and he didn't even remember getting his driving after revocation. And he's like, "Well, I've got court tomorrow." I'm like, I don't know what to tell you. You're not getting an appointment today. So, yeah, so it's gotten a lot busier again, but I'm afraid that's going to even off again. So, but we've continued to do what we need to do to serve our population.
That's awesome. That's great to hear too on our end, because I know that that's for some of the talking from coming from the marketing side of things, talking with the salespeople, and trying to get that message out there with our long-term testing. It's a really great option for
Yep.
people who haven't maybe started using the long-term testing that can be really beneficial. So I'm glad to hear that that's actually worked out how we think.
Yeah, it really does. When people are like, oh, don't you do urine tests? And I was like, for what? That's our population, unless we're walking around with a urine cup 100% of the time behind them, it doesn't serve them. They figure out ways to get around it. They use other drugs. It just all of that, those things that they can do. And so we're not worried about it. Back in the beginning, when we were doing the 5 tests, I could see the trajectory of people. They'd white knuckle it in the beginning. And usually they came in, first test was positive. And then they'd have a negative test. They'd have another, specifically for alcohol, another negative test, or PEth would be negative. And then that last test would be positive because they were not abstaining. They were only having 1 or 2 drinks, thinking that they were going to be able to control that. And our population, the population we're trying to help, can't manage their drinking, can't manage their use. And so those are the folks we're really worried about. If somebody can trick us and go a whole year, or we make all of our 1 and 2 offenders go at least 6 months. So if they can go 6 months and drink a glass of wine every now and then, what do I care? But it's those folks who we know can't maintain that reasonable drinking that we're looking out for.
It's a great differentiation. I know that's so we get some pushback sometimes on our testing, like our kratom testing that just came out, and we get some pushback that's like, why are you even testing kratom? It's not even illegal. And it's kind of like, neither's alcohol, but people have a problem with it. So
Yep.
People that have a problem with it, that is really our niche. So
exactly.
It's good to hear. Another question is there any push to try to standardize the process?
I'm pushing all over the place. So before COVID, I was invited regularly to go and speak at the trainings that we do for our assessors. And I try. It is such a huge change. And some of the folks have been in the business an ungodly amount of time and are like, no, we're not doing that. It's just bizarre. One agency actually had a grant when they were doing EDAC, and the staff were just so resistant to it. And I guess probably when I came in, it was, I was brand new essentially, and was like, hey, we're going to do this. We're going to change this. I wish everyone would. We had a meeting, I think last year sometime, and invited all of the area around. And so Racine came, and it was like, you guys should do this. This is awesome. You know, and they're like, yeah, we're not gonna.
Darn it.
Okay. So I'm trying, but yeah, I don't know. I think they really have to get over the idea that it's a gotcha. And I try and I try and I try. And I have I actually had a picture of an email somebody sent me that said, thank you so much. Your testing made all the difference for me.
Wow.
So they really have to get to that point where they understand that.
That's incredible.
It is.
So another question kind of following up on that is, what recommendation would you have on how we can reach other county testing sites like yours?
Well, go through especially like in Wisconsin, we have a whole list. It's on the internet for every agency that does assessments for
Yes.
IDP. And then the other thing, I had done a conference with Doug Lewis, where it was for doctors, and it was, but we're a little tiny nonprofit, and we can pay for that testing specialist pretty easily. So think about the aspect that you don't have to do the testing. That agency doesn't have to do the testing. It can be sent out, and you can partner with any nonprofit that does XYZ. Anything that's reasonable. I don't suppose the Literacy Council would be real interested, but so like the AIDS Resource Center or somebody else who does something similar in scope would be very happy to get a little bit of money to do this kind of work. So I think people need to understand that as well, that
Gotcha.
They don't have to do it all themselves.
It's good to know. Thank you. Is there a certain amount of time the client must have negative tests to then graduate from your program?
So no, not exactly. We try to spread them out. Like I said, our 1s and 2s have at least a 6-month window from not using. So they have their assessment, and we say, you will come back here in 6 months or after you're done with treatment, whichever is later. And so they have to have that whole period of abstinence, in theory. Some of them struggle, and we'll push it out again, because we're not trying to penalize people for recognizing that they have a substance use disorder. We're trying to help them overcome their substance use disorder. For those who have 3 or more, that first test is typically positive. They don't have any repercussions about that unless they told us it wasn't going to be positive. And then we're like, well, now you got to come in for another test, especially if it's alcohol. We'll do a PEth test with them. Then we usually they have to have at least 1 negative test before they can get off of their plan. And we do those about 5 months apart. So it's a 5-month window essentially for drugs of abuse.
I think that's so valuable. I know that when we had hopped on a call with the adult child sales team a month or so ago for a different thing that you're helping us out with, one of the takeaways that I had from that was, we talk about it, within our marketing and sales team, that it's not a gotcha. We're not trying to advertise it like a gotcha. It's really great to have that feedback from clients like you with, that's not what we're doing here. It's a little bit more altruistic than that,
Right.
And
Right.
actually we created a message from that was kind of like, is your recovery taking root, and is it really grabbing hold? And if not, we're gonna help you more with your treatment. We're not gonna kick you out the door and say, "Done." We're gonna bring you in and help you even more, because you need that support. And that's it's so imperative, especially for our staff, to really kind of understand that it's just because a lot of people get that stigma for like, oh, drug testing, and it's really not the space that we're in for that.
No, and again, the siloing of the drugs. So it ends up being, well, I'm only smoking marijuana. And it's like, well, so I have a loved one who has an addiction, and he came up to me and said, oh, I had a slip. And I said, oh, what happened? I said, you know what? Never mind. Don't even tell me. I know what happened. His drug of choice is heroin. I said, I know what happened. You were drinking. And he said, yep, I was drinking. I got drunk. I figured, might as well use heroin. And so when we talk about gateway drugs, yeah, sometimes marijuana or alcohol can be the gateway to harder drugs for your average teen. But in my world, it's a gateway to using the drug you really wanted to use. So somebody who only drinks, only uses cocaine after they're drinking, well, then you're going to really use cocaine. So we really try to bring their attention to that and not silo the drugs. Like I said, I don't care what drug you're using, you're so making sure that they understand their own addiction and that you're not addicted to a specific drug. We get a lot of pushback on that because people will come in and, like I said, they'll have the OWI only for alcohol and they say, well, why are you testing me for other drugs? I only got an OWI for alcohol. And I'm like, well, I do say, because when you kill my loved one, I'm going to be mad. But I also say, because the DOT says we can't. I'm like, I'm not going to argue with you about it. The DOT gave us permission to do this. But we've had a lot of arguments about, well, you have no right to do that. And I'm like, take it up with somebody else. We're
Right.
going to do it. So.
Yeah. We had a similar thing. I worked in a detox unit of a substance treatment center about 20 years ago, and same story was always like, what are you intoxicated on right now? But also like, what do you generally use? And that was the same kind of mentality. Was like,
Yeah.
what do you care if I use methamphetamine last weekend because I'm drunk now and drinking is
Right.
my problem?
Yeah.
Well, is it though?
Yeah.
Most people don't go off and just use other substances like that, and that's the problem.
Yeah. And nobody wakes up in the morning and says, today's the day I'm going to inject heroin.
Exactly. Yeah, yeah,
Yep.
that's awesome. So I think our final question is, what drugs are on the rise and may very well enter the forefront in the next few years? In your opinion, is there anything out there that you're kind of is on your radar?
I know there's a new drug that I don't even remember the name of it because we're still dealing with. I have a I get so frustrated with the idea that heroin or opioids are our only problem. And I think we've done a huge disservice to the population that we serve because of that. We There's so many programs, and Vivitrol is a great drug, and methadone's really helpful. But the problem with that is we're seeing a lot of cocaine use, and we're all again, oh look, no opioid positives. Well,
Right.
no, because they'd go into an immediate withdrawal if they use because they're on Vivitrol. So instead, they're using amphetamines and they're using meth and they're using cocaine, and I think we're doing a great disservice to our community by pretending it goes right up there with the ignition interlock device. We're doing a great disservice to the population by pretending that we're doing a great job addressing these problems and we're not. So what we're seeing a lot more meth. We're still seeing some heroin, but we have a great Vivitrol program here in Kenosha County. So a lot of that is being taken care of through that. But so cocaine and meth
Gotcha.
right now.
Great, thank you. So it looks like all of the questions that have come in through our chat. Thank you, all of the staff who entered those. We greatly appreciate those. Guida, you're fantastic as always. We are so, so grateful to have a relationship with you and to be able to call on you to be able to share this stuff with us. Once we get a link to this, we'll send it out to you in case you need to share it or use it for anything.
Awesome, thank you.
That's awesome. It goes out to all staff again in a link too, so they can kind of utilize it, and it goes on our intranet service. So
Okay.
Yeah, so thank you everybody.
Thank you.
Thank you for attending, and that wraps up our Feed Your Mind for the very end of October. Cool. All right.
Hi.
Thanks again, Guida.
Thank you.
Subscribe to our channel to see more videos like this.